with the Plant-Based Review, and we are here at Bellevue Hospital in New York City. Today was the public announcement from Dr. Michelle McMacken, Brooklyn Borough President Eric Adams, and the Chief of the Ambulatory Care Center that they are launching the first plant-based health and wellness program to treat chronic diseases, such as type 2 diabetes and heart disease.
My name is Dr. Michelle McMacken, and I can't tell you how thrilled I am to be in a position to direct the Bellevue Plant-Based Lifestyle Medicine Program. Our mission with this program is really to support patients in transitioning to a healthier lifestyle. And we're going to be doing that through a plant-based diet. And really what we're aiming for is helping people get to the root cause of their chronic lifestyle conditions, things like heart disease and type 2 diabetes. I have seen transformations in my own patients. And I have to say that for me, as a physician, I can tell you there is nothing like diagnosing a patient with type 2 diabetes and then fast forward in time, them being off of medications and having their type 2 diabetes completely in remission. There is no feeling that good for me as a physician. I imagine if it feels that good to me, imagine how great it feels to the patient.
I have been a diabetic for over 20 years and generally been treated by internists who have a very conventional approach to medicine with diabetes, don't have any regard for plant-based diets.
And then I started to do a lot of research, and I started to look into the Cleveland clinics, Dr. Esseley, the China study. I came across the physicians committee, website with all this information, and I started to read about all the damage that we really do to our bodies, and that never really comes out when you're meeting a care physician or your doctors. When I learned about this program, I'm just so excited because I have been looking for a program like this for many, many years.
I am clear on one thing, that people want to heal, and they're ready to heal. And I know that a chronic disease, it hijacks your life. It takes away who you are as an individual. And even as you move through your normal lifespan, you're thinking about the next test, you're thinking about hospice care, you're thinking about taking care of a loved one. It does not simply impact the person who's going through the chronic disease, but it also impacts the caregiver. And it becomes traumatizing for the family. And far too often, you start the declining path when you're told you're diabetic and you have advanced symptoms like I did, of losing my sight, permanent nerve damage in my hands and feet, having serious health issues because I was at the advanced stage. And the doctors merely told me that you would be on medicine the rest of your life. You are going to immediately start insulin and 3 other medications, metformin being one of them. And this was your destiny, and your family history led you to the day that you're in. And we begin to point fingers at our heritage and our DNA simply to learn that it has never been our DNA, it was our dinner. And we can turn it around. 3 weeks in, regaining my sight, 3 months in, reversing my diabetes, reversing my nerve damage, removing an ulcer in my stomach, seeing a complete reversal in who I was as an individual, and no longer had to carry the weight of disease on my shoulder, and then to have the ultimate success of convincing my mother to share this journey after 15 years of being diabetic, 57 years on high blood pressure medicine, 7 years on insulin, 2 months in to receive that call from your mother saying, I'm no longer on insulin. What more can you expect? There are Eric Adams all over this city that would love to show their mothers, their fathers, their aunts and uncles, their sisters and brothers a pathway to health. What we are doing today, we are not stepping outside the box. We're destroying the box. we are introducing in a real way in the oldest hospital in America a concept that is called disease reversal. That is not even thought about in medicine. We are rewriting the entire script of medicine in this country and the globe. And I want to thank all of these healthcare professionals who are part of this. You are going into boundaries where no one was willing to go before. And by using the letter of Bellevue, you are authenticating the possibility by using the prestigious hospital behind this initiative. This is so important what we are doing and what we are going to accomplish. All I can do is, to the best of my ability, is to get out your way and let you do what you do best. And let's heal New Yorkers and Americans. Thank you.